So here we go, guys. We are starting with polishing the patient teeth, which I skipped that step, and then we etch the teeth at the central force area of the crown part, rinse one tooth at a time. The idea is to avoid the etched material going to the tongue. Doesn't taste good. Uh, you train the assistant to do it right. A lot of times the assistant put it on the wrong spot. As you can see, sometimes it's the etched material go outside the suction, high-speed suction, and it goes into the tongue. It doesn't taste good. So be careful and just minimize the contamination of the etch to the tongue area. Would give patient very bad taste, and every time you have this problem, the patient will tend to salivate as you do the bonding. So be careful and do the best that you can. Sometimes I actually use a surgical suction to pick up all the etched material before I do this. Today I didn't do it. I skip it once in a while. All depend on how much time we have. Now we just put the bonding on each individual dry, chalky looking tube, making sure that we have a layer of bonding there. The best thing to do is using the brush and just micro brush and just keep moving around. That's really good to allow engage the chemical go into the enamel. Now we're starting to put brackets on. We have the measurement tool that we can know exactly. Central incisor is about 4.5 millimeters, lateral incisor 3.5, and so on and so forth. The canine about 4.5 millimeter from the incisor edge. That's what we do. I try to measure as much as possible on the upper arch. Sometimes you have to put on the account on the wear and tear of the enamel, and so you may have to go either higher or lower, depend on the wear and tear of the enamel. And that's where you can finish the cave beautifully after you adjust the incisor, whether it's a central incisor, lateral incisor, or canine when you have a wear and tear situation, and depend on your goal, whether you want to do that or you don't want to do anything with the incisor. Typically, at the general dentist, you have a lot of skill to get the incisor to the best shape as possible. People who, adult patients who start braces tend to have a lot of wear and tear of the dental incisor. So you want to reshape their teeth if you have to. It's improve the aesthetic outcome. And after the case done, the patient and you don't even remember that you did help him or her shaving up the wear and tear enamel and wrap up all the incisor edge, and it create a nice and smooth incisor. So you can do this before you start, or you can do it after. All depend on how your philosophy. So I done the brackets, and now I'm putting elastic. As you can see, this step here, assistant RDA can do this, not too hard. The first appointment, I do not want to do figure eight. I just do a basis one, just engage the tube, allow the force of the night tie wire do the work first for a few weeks to a month, coming back, replace it, and then you can start activate more force engage to the brackets. And anyway, so today we did all the bonding from molar to molar, left and right, upper and lower. Patient was spending some time on the office. We give the patient a little bit of jaw massage, make sure that she's not tired. Put some Vaseline on, take some photo, and give her post-op instruction how to manage her cell. First thing we want to tell her is don't eat anything hard and avoid hard food for the first 3 day, 4 day, and get used to the bite. We did raise the bite a little bit up, just allow the deep bite not crushing up the premolar. That's one thing that you have to evaluate after you put the brackets on. You see whether the bite is interfering. It's very important. to do that. Anyway, this video is more of the general information of how we start the ortho case. Please subscribe my channel, follow my channel, make comment, and follow me. I hope to see you the case next month. We're gonna give you the post-op update. See next few months how that case turn out, and follow me and see if you need this case need to have first bicuspid extraction or not. Enjoy your day, guys. Have a wonderful day. Please don't forget to subscribe my channel. Have a wonderful day. Bye bye.